we're at the legislature because these rallies are directly related to the government's policy to that seem to have the consequences of allowing unmitigated COVID spread within our society and at the same time hiding the numbers. And so as a democracy says that we as citizens should have our voices represented in the legislature, we know of no other way of getting that representation out there except for being out here saying we won't stand for this. I don't know of any other jurisdiction in Canada that's ever imperiled its entire population. And we have never been given a real justification. Dr. Hinshaw has really been the only one to speak on this. She said it's because we're now treating this as an endemic disease. You can't treat exponential growth as endemic. It's within the definition. Endemic means it's kind of constantly bumping around throughout the population, but we have like a doubling time right now of 5 days. So how can this be treated as an endemic disease when we have a life-threatening illness that's exponentially growing? I don't get it. I would like to have policy measures put in place commensurate with the risk of the fourth wave, as well as doing everything we can to protect our children, who don't even have the option of getting the vaccine. So, we have a month to get this right before school starts. That means adequate airborne protection with ventilation assessments of schools, filtration put in place, and we need to have mask mandates for every child in Alberta that's going to a school. So there's a lot to be done. We don't have a lot of time, and this government is, I don't know what it's thinking. I would offer it back up to you that we need to be asking our government what the hell's going on. I'm hoping that the school board step in. I'm hoping that the municipalities step in. I'm hoping that the federal government steps in because this government has abdicated its duty to its citizens. Well, predictions are really hard, especially about the future, but we know that the Delta variant is much more transmissible than the original variant, and we know that in the United States, who are 2 or 3 weeks ahead of us, that they're filling ICUs, filling hospitals, especially with young people, including children. And my fear is that the only difference between them and us is that we're a couple weeks behind.